Can you move your neck after a cervical fusion?
So after cervical fusions, many patients will wonder, well, if my neck is fused, will I be able to move it? And the answer is yes, you can. Most patients, especially for a 1 or 2 level fusion, most patients won't even notice a difference in their neck motion. Their day to day looking up, down, left, and right won't be different. And many patients actually will feel like they can move their neck more because the pain is now gone. So they have a bad disc herniation between the C5 and 6. If that level is fused, that pain can go away. And so they may feel more mobility than they did previously. So typically, neck fusions don't necessarily change your perceived motion. It does change motion at each segment that's fused. So when you measure it on x-rays, you can see less motion at those fused levels and sometimes excessive motion at the adjacent levels. But typically, especially lower down in the neck, motion loss is not detected. Now, that can change if you have a fusion higher up into the neck. So the majority of your movement in your neck up and down comes actually between the skull, the base of the skull, and the first cervical vertebrae. At least 50% of this up and down motion comes from that. So if that level is fused, if you have an effusion up to the skull, which some patients with severe problems may need that, those are the patients who will lose most of, if not all of their neck motion. But that's less typical.